We are live.
Aloha, Charlie.
Hey, hello, Mel. How are you?
Welcome, everybody. Welcome, everybody, to Facebook Live with Mel and Charlie.
Special edition
Um,
Sunday. Yep.
very special edition tonight on this Sunday night. As you probably already know, this thing was shared over 200 times on my post. So I think when you add all the different people that shared the shares, we several hundred shares. So we expect a huge crowd tonight. Want to thank you guys all for being on tonight. Our guest is Sergeant Lana Hughes from OCCC. OCCC has been in the news lately quite a bit. We all know about the massive cluster that happened over the last few weeks. And Sergeant Lana Hughes was one of the correctional officers that contracted COVID 19 while working at OCCC. So we asked you to come on to share what's really going on, Charlie. I know we have been talking about this for a while now. The
Yes.
newspapers, we've seen the numbers, we've seen the numbers, and as of yesterday, 243 inmates and 48 staff members have tested positive, and Sergeant Hughes is one of those staff members. As a result of this, many inmates have been released because, and we'll hear more about this from Lana, but on the 22nd, 31 inmates was released. On the 21st, 11 were released. On the 20th, 25 were released. On the 19th, 23 inmates were released. These numbers came straight from OCCC, and it's kind of a crisis over there, Charlie. Kind of a crisis. So we really appreciate Lana stepping forward. And I know there were some comments out there asking if she got paid. Nobody gets paid to be on our show. I'm not sure where that question came from, but actually, Lana is coming on probably at some risk to her future. So anyway, we appreciate her being on. We appreciate you guys all being on as well.
Well, one thing we know, she's a brave individual. I'm gonna let all of you folks know right now. She she has um, informed legal counsel, and they gave her permission to speak with us tonight. So we're gonna be very very targeted in what is spoken of. It's really about trying to get um, I guess safety measures in place, or just finding out what seems to be the problem, because there is a definite disconnect there, and it's there's just one facility. There's the rest. There's Kauai, there's Maui. Maui earlier, last what was it, last year they had the riot situation, and there's still a disconnect, and we're just trying to find out. Many of us want to know why is that, and this is not about. It's not about it, and I want to say this very gingerly. It's not about pointing fingers. What it is about is that all of that kind of stuff is going to take care of itself with down the road, on however legally things proceed. But here you got a brave individual who's going to share her story and kind of clear some things up for us tonight. So, and I'm looking forward to that. But real quickly, Mel, may I? We got such good fans that watch us. A gentleman by the name of Eugene Fernandez. As I was in the shower, he jumped by, knocked on the door, and luckily my wife answered the door, and there he was. And he knew about the distant learning for the kids, and he took some courses at KCC and used a laptop only twice, and he didn't know what to do with it, and he wanted to donate it to whoever could use it. So he stopped by and dropped off a Chromebook by Samsung that's only been used twice. So he told my wife to tell Uncle Charlie that if there is anybody out there, a child parent, if your child needs a notebook, I know it's pricey, but you need that help for your child. If your child is going to have to get distance learning, if your child is one of those, please private message me on Messenger, and I'll try to get it to you. I mean, that was so nice of that individual. Thank you, Eugene. Appreciate it, brother.
Amazing, amazing, amazing. That's the kind of people we get here on Kauai.
Yeah.
He could have easily just put that up on Facebook, Craigslist, sold them, make a few bucks. But Eugene, he's the guy has been a community guy. He's given all his life with sports, and I mean, really, he could have made some money and instead decided to give it to somebody that needed it. Incredible. God bless Eugene and his family.
Yes.
Awesome, awesome. Also, now would
Don't
be the
forget.
time, Charlie. Where's your high tech? I get the paper one. Charlie has the high tech graphic. Go ahead and share this with on your page, um, please. It's going to be some important information. Again, what we have found on this show is everything that you've heard in the media may not be as accurate as we would like. We've heard a lot of excuses from all over, from all the departments, whether it's unemployment or from the contact tracers, Department of Health, and Department of Public Safety. We try to bring the people that are on the front lines here so they can share what's really going on, and that's what tonight is all about. I did speak with Lana earlier today, which we normally don't. I don't normally talk to our guests, but today I did, and I said, we just want to inform and educate. We want the people to know what's truly going on. We Charlie and I, former law enforcement, we definitely have an amazing appreciation for all of you correctional officers, all you staff members, people that work in the kitchen, everybody that works in a facility. We just love you guys to death. But the other part of it is our inmates. They're paying their debt to society. They deserve to be treated fairly and given a safe and healthy uh, place to live. I mean, so it's not just throw them in there and tough, let them rot. No, we gotta make sure that their environment is safe and healthy as well. So this is a huge, huge topic. I don't know how we're going to stuff all this into an hour. Maybe go a little longer. I'm not sure. But if not for people like Lana, Sergeant Hughes, that's willing to step forward, imagine how she's feeling. She can't hear us right now because she's in the waiting room. But imagine, whistleblower, right, comes to mind, like the lady from the contact tracers. It's tough to do. Most people will not stand up and speak out. And so, we really appreciate her coming. And I hope I know we have a ton of legislators that'll be on tonight. I know media will be on tonight. I think everybody's going to be on tonight. And we want to share her experiences, personal experiences with the general public. And that's what's going to happen tonight. And it's going to be an incredible show. It's going to be an incredible show.
Yes, I am. Like anything else, Mel and I, folks, it's all about to inform and educate. And tonight's show is no different. It will be a sensitive subject. We will work together in trying to get information out to all of you, but we will not put any words in the guest's mouth. That's not our intent. We don't do that because that's what happens when people get their backs in a corner. And if you're not careful, a lot of things could be said and taken out of context, and that's not what we're about. We're about getting the straight information, straight talk. Then, for those of you out there who feel that they too may have been subjected, possibly, to some wrongdoing, then speak up, give us a call, let us know. If we got to bring you on too at another date, we will. If there's some information that you would like to share, it's all about sharing the information. It's about sharing the information and how can we correct the problem. And so we can all move forward. I mean, we no different than how we went after the Department of Health. It's about, hey, let's correct the problem and let's move forward. And that's what Mel and I are all about.
All right. So we are going to bring Lana in and start this. And again, we just want to mahalo Lana for her courage, because it's again very very tough to do. So
Aloha.
Aloha.
oh great great. You know it was. You know, my Okole always bite the seat when we get guests coming on to make sure the video work, the audio works, so everything's working. I feel good. Thank you, Sergeant Lana Hughes from Oahu Community Correctional Center. Um, we appreciate you being here tonight. You know, Uncle Charlie, I mean, you called me Uncle Mel, so I guess I can be Uncle Mel. But it is what it is. I'm proud to be your uncle.
Yeah.
We again appreciate you and thank you for your courage to step forward. As we talked about, you know, this show is strictly to inform and educate. A lot of stuff floating around about OCCC. We talked about the numbers: 243 inmates, 48 staff as of yesterday tested positive. I'm not going to steal your thunder. We'll give you an opportunity to share your story. Just want to say this is a critical time for OCCC and their inmates and their employees, and we just appreciate you being here tonight. So
Thank you.
So let's start off, Lana, by first of all, letting the people know who you are. When you started this career of yours at the Department of Public Safety as an guard, I'm sure, and just give a little background about who you are. Okay.
Okay, so I started at OCCC as an EH, which is considered an emergency hire, back in 1997. I graduated in BCT Basic Corrections Training in class of 9902. I have like 21 years of service at OCCC alone, just at the facility. Um, I've been a sergeant for 9 years. I got promoted from 2011 as a sergeant.
Okay. Now, you know,
what about Lana?
Yeah.
What about Lana?
Yeah. What about Lana?
Who's Lana Hughes? We know Lana, the jail guard, or uh, uh, correctional officer, but who's Lana Hughes?
Well, I'm a single mom. I love my son. Um, I work really hard. I love the beach. Maybe I haven't been going to the beach. I love hanging out with my family, friends, but that's put on hold for now. Uh, I just want to, you know, talk to everybody and let them know that, some people don't or can't imagine what us ACOs go through daily. It's not easy, you know, appearing to be strong all the time, but for tonight, I'm doing this for my son, for myself, for my fellow brothers and sisters, especially at OCCC and corrections. Um,
What
I'm
school?
speaking out.
What high school did you graduate from, Lana? High school. What high school?
I graduated from Kalani High School.
Kalani. Oh, okay.
Okay.
That's OIA. Yeah, OIA. Okay, okay. I'm sorry. I went ILH. So okay, but hey, that's
Oh
still
God,
good. That's
this
good.
guy, I tell you. Hey, I'm Kawa High School, KIF, public school, not no, but anyway. Hey, Lana, how old is your son, and why are you stuck at home?
My son is 11 years old. He just made 11 Friday, August 13th, but I was unable to celebrate his birthday with him because of the outbreak in the jail.
So I mean, we'll find out exactly what happened and how. But you currently right now are in isolation. You're quarantining at home because you tested positive, correct?
Correct.
Right. Yeah, we pray for you to, we pray for you. Obviously, we all pray for you to get past this and come out of this okay. And please know that. I mean, I'm watching the comments, and girl, you got a ton of support, a ton of love flowing your way right now. So that's awesome. That's awesome.
Thank you.
So, Lana, there's just been a ton of stuff going on at OCCC. We knew when the first outbreak, and then it just grew and grew and grew and grew, and different media sources cover different parts of it, but you were there from day one. You you witnessed what happened, and I would like to possibly take you back to the day before the first case. Everything was running normal, and then what happened when it changed, when we got that first positive? What happened?
Okay, so I'll just show you my calendar right here. I just kind of write everything down. I'm not reading anything. It's just the dates that I need to get right. So on August 7th, on a Friday, I found out an inmate tested positive. It was about 7:30. I was getting texts from co-workers telling me an inmate in Annex 1 had tested positive as going to be rehoused in Module 7. So with that, I didn't want to go to work because I didn't want to catch the coronavirus, you know. So I called in sick on the 10th and 11th because I'm off Saturday, Sunday, which is the 8th and 9th. On Monday, the 10th, I took a COVID test around at the facility around maybe 1:30, and it was kind of like a last minute uh, announcement, and it was for primarily for whoever worked in module 17, oh 18, I'm sorry, module 18, 19, and Annex 1. So of course I raised my hand. I text back to the ACO that was making that announcement that I was interested in taking the test. Went to the facility.
So were you asked if you wanted to take a test, or were you directed to take a test?
It was just an announcement, whoever wants to take a test. And
Okay.
primarily, you know, whoever was working in those areas.
And you was working one of those areas.
I was working in Annex 1.
Okay. Okay. And then what happened?
So I took the test, and I asked the chief if we have leave and stuff like that. He said no. At first he said yes, we can take admin leave. And then I've been hearing that we can't take admin leave. So I stayed out anyway. I said, well, I'm going to stay out until I get my results. I'm not coming back to work until I get my results. On Tuesday, the 11th, I found out that I was negative. So I said, okay, what do you want me to do? He goes, I said, do you want me to come back work? He said, yes. So came back work. That was Wednesday the 12th. And as I was looking in the logbook in Annex 1, I saw that Annex 1 had done a COVID test, the whole Annex 1 inmates. Everyone living in Annex 1 had done a COVID test with the National Guard. So I don't know the results. I don't know anything. I just came into that and said, okay. Next thing I know, medical staff came in wanting to do the temperature check and pass out medication. They were all dressed up in PPEs, you know, from head to toe, double mask, shield, hoodie, shoe covering, everything. And here I am with just my staff, just with a mask. That's not even gonna protect us. So, anyway, business went on. So that's one day. Business as usual after that. The very next day on the 13th, Thursday the 13th, same thing. So now I'm going to the chief. I'm like, okay, I want N95 mask. I want protection for my staff. So he gives me a shield, and he gives me it wasn't the N95 ones. I think it was like KN95. I don't know what, it's some kind of off brand that's like probably from China. I don't know.
It's probably the
But it wasn't-
KN95, the
Yeah.
KN95, which is from China.
Yeah.
Right. So The nurse comes up again, does a temperature check, and then I realize, while they're getting ready, I'm like, okay, so how you guys want to do this? The same thing we did yesterday? They said yes. And I said, okay. I said, so one of the nurses pulled me on the side and said, you know what? Out of 112 inmates, 65 of them are positive. I'm like, I don't know what to do. So I said, okay, we're going to do a temp check like we did yesterday, right? And they said, right. And I said, okay, so we're going to go to the other side of the dorm because there's 2 dorms in Annex 1. They're like, oh, there's no sense for that because they're all mixed together.
Oh.
So I looked at the inmates. They started getting antsy because they knew.
Lana, real quick. So the 65 that tested positive were all with the rest? Is that what you're saying?
Yes, they're all mixed in with the positive and negatives are all mixed together.
They did not isolate the
65. They're all in clusters. Dorm 1, Dorm 2. Dorm 1, 58. Dorm 2, 54.
Wow.
And so now I'm looking at thinking, okay, so I have 65 positive inmates for COVID. So now you're trying to tell me I have 112 because it doesn't matter. Because that's what they told me. It doesn't matter. So the inmates, knowing that they took their tests the day before, they know it takes about maybe 1 day. So I don't know how they figured that out, but they knew. So I said, they were like asking me, what's the results? They started getting aggressive, asking the nurse, demanding. And I said, all you guys need to chill out. You guys need to relax. As soon as the medical staff leaves, I will, let you know your results to, take the focus off of the medical staff now. So that helped. And they waited their turn. 2 inmates did not want to have their temperature checked that day. They wanted to go sick call. We've been signing these inmates up for sick call, but the medical staff didn't want to see them for sick call.
And is that because they may have been positive?
Yes.
I mean,
and it's a infested house, and it was considered lockdown, so nobody's to leave Annex 1 and nobody's to come into Annex 1.
Even if you sick?
They didn't want to see them. They just was wanting to do the temperature check and wanting to give the meds. That's it. So two inmates.
Before I forget, I want to go back to, you said you took the test, you tested negative.
Right.
And then while you were waiting for your test result, could you have gone back to work, or were you ordered to stay at home until because I remember you saying you asked the boss, what do you want me to do? You want me to come back to work? And he basically left it up to you. If you wanted to go back to work while you were waiting for your results, you could have gone back to work?
Well, I already had gotten my results. It was negative. So I asked him, what do you want me to do now?
Okay.
Do you want me to come back to work? He said, yes. So I came back to work. That's what led me to work on the 12th.
Okay. Sorry about that. I'm just trying to make sure I get everything understood.
Okay.
All right. So the guys, they're not allowed to go to sick call. No,
well,
stay in.
The medical staff wasn't treating them.
Okay.
Okay. And then what happened from there?
It was obvious that 2 inmates, especially one of them, was very, he was upset because they're not listening to him. He has aches and pains, symptoms of the COVID, and nobody's helping him. So him and another inmate refused temperature check. And so they're arguing with the medical staff. I said, look, this is not an argument. If you don't want to, have your temperature checked, that's your right. So we're done. So he cooled off, he left, and that was that. Later on, the medical staff did give me 4 Tylenols to give to that particular inmate because he was complaining of body aches. At that time, I didn't want to just give it to him right away, so I waited till he cooled off. And later on during the day, I gave it to him. I said, hey, the nurse said to give this to you. And he said, thanks, Sarge. That's all I want is somebody to listen, because we're having symptoms.
Now, Lana, when you're working in this module with these inmates, you don't have PPE.
No,
You don't have a protective gown. You don't have gloves. You have a
no, I have
KN95
gloves. I
mask,
have
but
gloves.
you did have gloves. The vinyl, I mean
Yes,
the plastic gloves, the rubber gloves.
yes,
I
But
think
yes.
no overgarments, none of that type of
No,
PPE. And at this point in the schedule, you know that 65 out of 112 inmates in your area are positive
yes,
and no PPE.
no PPEs.
None of the guards have PPEs.
No, they're not dressed. We're not dressed like the medical staff.
Right.
let me ask you something with regards to testing. When the ACOs had an opportunity to test, they just put it an announcement, and it was like, hey, if you guys want to get tested, fine. You don't want to get tested, no need. It wasn't a requirement, right? That's the way I understood it.
Yeah,
But when it
right.
came down to the full testing of those Annex 1, or those uh, Annex and the other numbers you had mentioned, it
Oh,
was, yeah, it was almost like mandatory testing was going to be done.
it was shoot. It was a text, and it said it was like it was on Facebook, on
Yeah.
the union page, for all the ACOs to read. It was kind of like a last minute announcement. It was a last minute announcement. It was like, hey, if you want to take your, the Department of Health is going to come down. If you want to take your COVID test, primarily these are the staff that's going to be taking it from module 18, 19 at Annex 1.
But as far as the prisoners, when they got tested, it was a mandatory test.
I don't know, because I wasn't working that day, and it was on the 11th, on a Tuesday. So I called in sick that day. That's the day I got my result.
Okay.
So I
Okay.
wasn't there.
So you guys read it off your union page on Facebook. Is that what you said?
Yes, yes.
So you didn't get a phone call or a email or a text message from the Department of Health or from the Department of Public Safety?
No, it was announced through one of the Warden Select Administrator, ACO 3.
Wow.
You know what I'm trying to get clear here is, so when these prisoners were tested, and I know, they throw around HIPAA a lot, but you folks are responsible to watch them, to keep everything under control. They don't tell you folks who might be positive. Straight information, straight talk. Then, oh, I'm sorry. Okay. Boy, I thought I was Back to the Future on there.
Bro, I thought it was a police radio. I was like, what the heck? Wow.
Sorry.
No
Yeah.
problem.
So basically, when someone is sick, when a prisoner is sick, I mean, it seems like you folks gotta go try search who's sick. They don't just come and tell you who might be positive, to give you guys some kind of warning that, hey, we have
And
a.
that's the thing. When I reported to my assigned post on the 13th, Thursday, nobody told me that I was bumping into 65 inmates being positive. I could have at least taken the extra precaution and wear 2 masks, give my staff a heads up, like, hey, there's 65 inmates positive. We gotta, have more protection. That's the sad part, because, I signed right in front of the lieutenant and captains. They didn't say one word to me. So now I'm dealing with the situation with the COVID of 65 positives, and the tension is high because they want to know the results. The inmates wants to know the results, which is understandable. They're having symptoms.
So there is no staff because there's so many inmates who may, you're saying, maybe displaying symptoms now. There is no medical staff to come there and do a check on them. It's as if the person has to say, you know what, I want medical attention. That's the only way they're going down to wherever to get checked medically.
We usually sign up for sick call, but even when we were signing up for sick call, those 2 days I was working,
Yeah.
none of the medical staff wanted to see them.
And did they tell you why they didn't want to see them?
No.
And
So all it could,
did you bring it to anyone's attention that, you know, based on your experience, you see someone who's sick, medical staff don't want to see them, but you're thinking, hey, this person is not acting out of the norm. So did you take it to anybody higher to say, hey, you know, you got to do something about this?
we called, and I think my staff went call the upper chain of command, but we're in lockdown. Nobody to leave Annex 1, nobody to come into Annex 1. So I'm like, okay, you know, I'm stuck in this position, you know, and
It's horrific. It's horrific. I'm seeing a lot of comments, and you know, when I'm looking down, Lana, it's not because I'm being rude. It's because my phone is low, and I need to get this thing up here. And I'm trying to read the comments, but there's a lot of comments. I'm assuming from corrections officers and spouses, and one of them is saying that the testing was voluntary, not mandatory. Also saying that they, you know, basically supporting what you're saying, but the one that got me is the one said that the husband was never contacted by DPS or Department of Health, even after testing positive. So it's a systemic issue. It's a problem, and I tell you what baffles me the most, and we'll move on real quick. But what baffles me is how in the heck can you not separate those that are confirmed positives? And
it's impossible. You can't. There's no 6 feet distance, social distancing. There's no way.
Well, let me ask you this. Did you folks have any kind of plan for something like this, a pandemic plan? Is there a plan in place?
That's what I heard. I heard that Nolan Espenda had a pandemic COVID plan that was in effect, you know.
But did you see it?
I have not seen it.
Okay.
Only the day I came back on the 12th, I seen a pamphlet that was kind of like just on the control station. I'm like, where'd this come from? And it was dated August 2020, the year 2020.
Yeah.
And it was a revision in the middle of an outbreak.
And that's the first time you saw that?
That's the first time I seen it. It was dated August, so it was.
Yeah.
You know, it's
so you're saying you're seeing a revision of a plan, yet you haven't seen. So I'm going to ask you: did you see the original plan? Was the original?
I've never seen the original plan.
So you're seeing a revision of a plan that you've never seen before. So
Right.
you don't know what the revisions are, then, right?
Right.
Oh my God. Oh.
Correct.
So you 21 years, 9 years as a sergeant.
Whew.
There was no plan, or you've never had any training or any type of any kind of preparation or drills as it relates to a pandemic? Absolutely not.
Nothing.
And then you come across this August 2020 pandemic plan revision.
Yes, correct.
Amazing. What happens if an inmate gets sick? Just let's say an inmate gets the flu or some kind of contagious, not pre-COVID. I'm not talking about COVID. They go to sick call. Are they isolated in any way? Are they kept from the other inmates?
If they don't feel good, they just say, hey, if you can sign me up for sick call, then I'll sign them up for sick call. Whoever my staff is working will sign them up for sick call. And usually the nurse will come in and, you know, ask them a few questions, and we'll send them down to medical unit. But because of this outbreak, nobody could leave. They're saying that nobody could leave Annex 1 and nobody used to come in Annex 1.
Yeah, just let the virus circulate and infect everybody. But I mean, pre-COVID, on a normal in a normal situation,
Yeah,
normal.
we sign them up for sick call, and they go sick call in the morning. We call it out, we announce it.
And then if they have a contagious disease, they're not allowed to go back and mingle with the rest. Or is there provisions for these people to be isolated from others so that they don't contaminate?
No.
They go sick call and they go right back into population.
Yes. Yes.
Wow, interesting.
I
Okay.
don't know what the condition of their sickness is, or it could be sprained pinky.
Yeah.
I just don't
So
know. I don't really listen to their health issues when they're talking to the nurse.
so basically, if I get this correct from the start to where we are now in this discussion, when there is well, let me kind of back up. Several months back, you folks had a release program, right? Because they were worried about COVID, correct? I mean,
Correct.
prisons throughout the state, so we know about that.
Right.
And yet there are a lot of quandaries about it because everybody's saying, wait a minute now, is there any active cases in the prison? And at the time, there were none, but they were going to go and release. Okay. I'm just looking from a very simplistic point of view. It's something serious enough to warrant a release. A plan should have come out back then, but none. It seems like none was. So there now you got this problem, and you've got 65. Well, it's almost the way it sounds. It's almost like you had to kind of like dig in to go get that information. It wasn't just offered to you that, hey, you get 65, because there seems to have been a problem brewing, but it doesn't sound like all the staff were made aware of that. It doesn't sound that way. So okay,
No.
so if it's that case, then my question is, was it ever suggested from a medical standpoint that hey, we may have a problem, we may have to separate these people because we definitely have a problem? Was anything like that ever said to you folks?
Nothing.
Nothing
Nobody
at all.
guided us. Nobody said anything to us. I just ended up calling in sick because I could see stuff brewing, and if inmates are having symptoms and if they have a hard time breathing, I was just afraid of vicarious liability. Hey,
Okay.
you're responsible for this. you know Before all this, before the 7th, the inmate testing positive, I thought we had it under control. I thought OCCC had this under control.
Okay.
So Lana, up until this point, you still haven't tested positive.
I tested positive. So on the 16th, I took a COVID test at Kaka'ako Waterfront.
Was that because of symptoms? Was that because you were again alerted, or was it just you felt
It was because I was now exposed to 65 inmates positive.
okay? So you
And
went on your
so
own though, but you went
I
on
went
your
on
own.
my own, right? And I just didn't like the way it was handled at the facility as far as taking the tests, COVID tests.
Mhm.
When I called the chief of security, I asked him, what's my results for my test? He said, it's all good. I'm like, so all good means negative? He's like, yes. And I'm like, okay, but I never received any paper that's documenting that I am positively negative. And so that's the reason why I went down to the waterfront to Dr. Miskovich, getting that COVID testing done. And then after that, on the 19th, on a Wednesday, I got a call from Dr. Hugh that I tested positive
That was off of the Miskovich test.
off of Miskovich's test. Yes, correct.
And Dr. Hugh is with Doctors of Waikiki.
I think she's with the
Dr.
medical.
Miskovich.
Yeah.
Yeah, okay. So you take the test on your own, Kaka'ako, and then you find out now you're positive.
Yes.
And then what happens from there? I mean, do you notify the jail? What happens next?
Well, I notified everybody on Facebook and on our union page that I tested positive. I'm one of those that tested positive. There's a whole list of ECOs that tested positive. So we were just making it aware on each other, as a co-workers that, hey, I tested positive, I'm negative, I'm positive.
So you notify everybody, and now since that day you've been home.
Yes.
I wanted to and again, we all pray for a good end to this, and hoping that you don't get sick and you get through this. But I kind of want to go on a different tangent now. Because we have, you folks accept inmates every day. We know the problem right now. Now I'm really upset, though. I'm even more upset now, knowing that 65 were just allowed to mingle. We'd heard that. Again, we try not to spread rumors, and but that's why you're here. Now a new inmate comes in, because I don't know the layout of OCCC. I'm quite familiar with KCCC, but I'm not familiar at all with OCCC. The new inmate comes in, however, they show up. What's the process? What's the policy as far as making sure that inmate, that new inmate, number one, doesn't come in contact with a potential positive at the facility, or number two, bring the virus into the facility? What's OCCC's policy, or I should actually ask you, how is that inmate treated? What's the steps that happen when a new inmate comes into the facility?
Well, they have to go through intake, and through intake they go through the medical unit, and from there they get housed by Module 5, because Module 5 has all the computers and where everyone is, housed, and they have all the census, the numbers. But normally, I would say the new inmates were coming, because of this COVID, this pandemic, the new inmates were being housed in Module 19, which is supposedly is the quarantine module. And from what I've heard,
okay, go ahead.
From what I've heard, I don't know whose idea it was, but they're cutting corners and not doing the full quarantine 14-day protocol.
Yeah, that's kind of what I wanted to find out. Is we had heard, and we're hearing from people on that work or are married to corrections officers at OCCC that in fact some of these people were being released into general population after 5 days, or even sooner. Does a new inmate get tested for COVID?
Well, I'll give you an example. On the 13th, when I was working, one inmate tested positive. He was on the list, and he got released. So now he's on the public, on the community right now.
You
So
mean
we-
one of
We
the?
alerted Module 5, but I don't know what happened, and they went through.
This is part of the release program you're talking about. This prisoner, is that what you're talking about?
This incident happened on the 13th, so I know for sure. I had the list of names, and I looked at the list of names, and I looked at the inmate that was getting released, and that inmate was positive.
Now, did you bring it to anybody's attention above you?
My staff brought it up to Module 5. We called them, but they still released them.
And did they say why?
Nope.
So let me ask you this. We have someone roaming the streets of Honolulu who's adding to the problem while we're trying to cure the problem, right? Was this person, do you know if this person had a place to go or what?
I wouldn't know. Intake services would know all that, those information. I just don't have that kind of information with me, or would know.
So whoever, say somebody came to pick him up or her up, whoever the prisoner is, right? Information is not given to let them know that, hey, if they were picked up, you're picking up someone, you need to be aware that this person is COVID positive, because that's how contact tracing, right? You hear about these contact tracing, knowing who you come in contact with. But it sounds like the prison didn't even go that far. Am I correct?
You're correct.
Wow. So they
Yeah,
let somebody out. They
because
let
the thing is,
somebody out.
I had the list,
Right.
and so unless they go through intake and medical unit, they're the only ones that can inform them.
Okay.
Because now they're out of my housing unit.
Okay.
Well, since the 19th, there's been 90 inmates released. 90 from the 19th to the 22nd from OCCC. Now, obviously, we don't know the virus. We don't know how much of the virus. We don't. How are they keeping the positive inmates away from the rest? I'm not sure. You said they have a quarantine module, but even at the quarantine module, are these inmates individually housed? Are they grouped together? Are
Well,
they
I know
treating
Annex 1,
those?
they're all grouped together. They're in
Yeah,
clusters.
and I mean, that could be the main reason why we've 243 inmates tested positive. And, you know, you're talking 65 out of 112. Let's just assume that all 112 tested positive. That still leaves, you know, another 100 plus inmates that got the virus. So
Right,
there's some
because they
serious
didn't really.
issues.
So, because they did the
Whether
test on Tuesday. So, PSD did the test on Tuesday, Department of Health and, the National Guard, right? So now the nurse is telling me out of 112, 65 are positive. Now it doesn't matter, 112. But that number is not really showing in the news because they would have to be retested because now
right.
they're probably infected.
So this 112 inmates that were more than likely, at least we know exposed. We definitely know they were exposed. Whether they contracted the virus, that's another story. But we know that 65 tested positive. At the end of the day, I'm sure most of the rest tested positive. Do these infected inmates have an opportunity to mingle with other inmates from different parts of the facility? In other words, we've had 243 positive cases at OCCC. Let's say we count 112 of them from the annex 1 or annex 2, whatever. There's still 100 plus inmates that got this virus, and I'm trying to figure out how would that have happened. Now, could be employees that were transferring, you know, infected employees that were infecting other employees that were coming in contact with inmates from different modules. Could be medical unit, could be at the dining hall. I'm trying to figure out
So,
where did all these numbers
so
come from?
as far as I know, before, like I said, August 7th was the first, you know, initial inmate that was tested positive. Okay, I thought everything was all good because it's a little community. OCCC is a little, community. We're running rec like normal. We're running education and law library normally. Everything was normal up until August 7th when we all found out one inmate was tested positive.
Were anyone after the first case, that first positive inmate, were visitors still allowed to come in? Were people
Yes.
still, even after that first positive?
After the 7th,
Yes.
I don't work main entrance, so I really can't answer that.
Okay.
Okay. Let me ask you something. Yeah, based on what we've hearing so far, we kind of get a gist of there's definitely there is a breakdown in the system. I mean, that's what it sounds like. There is really no pandemic response or direction. So now the numbers, you go back to work and you know that the numbers are higher than before you left work, correct? So you know the numbers are higher.
Yes.
Did the prison administration make any attempt to properly um, get everyone fitted with PPEs now that you have a very volatile situation? Did they?
No, not at all.
So I saw we want to put something up on the screen. Mel, you have that screenshot. We can maybe you stay right there. We're gonna share screen. So we want to show. You'll be able to see it. Okay, you'll be able to see it, and the viewers will be able to see it. But I'm gonna show you something. Those of you out there.
Oh shoot. Okay.
Oh shoot. Oh shoot.
I'm trying to see it because I can't see.
No. On your screen, you're gonna the screen that you see right there. It's gonna come up. It's gonna come up.
Okay, hang on.
Okay. There. Okay, this is we got in Big Island sent me. Can you see it on the screen?
I can see it now.
Okay. This was from a memo from the Big Island. So I'm pretty sure prisons, they operate under this informational guideline from administration. It says, effective immediately, anyone not trained for N95 mask is unauthorized to use the N95 mask until further notice. The facility is currently in the process of getting trained and certified for N95 mask use. Per CDC guidance, N95 masks are to be used when there is active COVID-19 cases. Currently, HCC, which is the Big Island, right, does not have any active cases. If you're caught using an N95 mask, you'll be subject to disciplinary action due to failure to adhere to a written directive. The use of cloth masks are allowed. So the way I understand this, and it may or may not apply to OCCC, is that if you have COVID, you should be getting one N95 mask, plain and simple.
I would think so, yes.
Yes, but you folks didn't get one, right?
Didn't get one. We wasn't issued no N95 mask at all.
Okay. Now you can put up the other one I sent you.
Okay, I don't know if that one, I'm not sure if I have, hang on.
Because I received, and if not, then no worry. I received information of the mask that you folks have. That's from the Department of Human Services. They're right there. Does this package look familiar from the mask that you folks get? It comes in this package right here. Does that look familiar to you?
Yes, it is. It's a cloth white mask.
Yeah. Okay. Now you see right there, bullet point number 4. Go down 4 bullet points. 1, 2, 3, 4.
I'm seeing it.
Yeah, the face covering does not replace the N95 used in healthcare settings and should not be used when caring for those with COVID-19. That's what they issued to you folks.
That is correct. That's the only ones they issued to us.
Okay. Thanks, Mel.
That's therein lies the problem. I mean, I think Charlie
and then after the fact that I guess I found out 65 inmates were positive, I told my lieutenant, and I guess he went and called the chief of security, and they brought like 112 masks, those cloth masks, after the fact.
Not N95s.
No N95s. It was those masks, those cloth ones. I received 112 for each inmate, one each.
You mean just regular cloth masks? The
regular white cloth mask.
No.
That's after finding everybody's infected.
I see a lot of comments from, I'm assuming, guards that are saying, just sanitation in general, just to protect you folks. They our ACOs are, our guards at the facility. I'm seeing a trend of comments about these guys having to. Some are saying they even weren't issued any masks, but they had to provide their own cleaners and disinfectants and that the
Well,
facility never
the
provided?
facility, yeah. Well, the facility, they have cleaning solutions, but what they do is they water it down. So I don't know how effective it is and if it really does disinfect. I overheard that they were going to do a deep cleaning, and from what I heard, they only did a deep cleaning in the kitchen, FSU. What about the other areas like Annex 1, the quarantine modules? In fact, the whole facility, because the whole facility is infested with the COVID.
Right. So in a normal business, in a normal, and I understand, correctional centers and jails are different, but when a facility, a restaurant or a business has a positive case, an employee, they got to shut down and deep clean the entire location, and
That was my. I was so curious. I was so upset because every time I watch the news, and I'm sure everybody that's listening to this have watched the news, and you see Honolulu Hale 11 exposed COVID, deep cleaning. You hear the fire department deep cleaning, sanitizing, disinfecting. You hear everywhere else but our facility.
we just
Our
saw
facility.
Rainbow Drive-In.
Everyone's-
Everybody loves Rainbow Drive-In. We shutting down for deep cleaning.
Exactly.
So that
O triple C
obviously
never.
that obviously did not happen. Your inmates weren't relocated to another module or another facility. That place never got deep clean.
To
As
this
of
day,
yeah,
as of right now, it hasn't happened.
with 240 plus positive cases, it still has not
And
been deep cleaned.
right, and in Annex 1 especially, and the quarantine. The whole facility. I mean, Annex 1. I found out Annex 2 is positive too now. All those, the whole facility, all the housing units needs to be disinfected. Sanitized and deep clean like everywhere else.
Okay. Now let me ask you this. I am sure. I mean, it's pretty obvious. You have a lot of people here supporting you from the comments that I've seen. So I am sure that you probably get calls from, without mentioning names, but just in general ideas. I am sure you're probably getting an update of what's happening behind the prison walls. Okay. Have you heard anything that would kind of give us any kind of indication, us on the outside, who maybe are inquisitive, like myself, to know if in fact they started a process to separate the infected from the non-infected prisoners?
Absolutely not.
It continues because if I mean I don't know how the structure. I'm sure you say you got Annex 1, you got 18, 19. Do you have uh, buildings, what, 15, 16, and all of those, right? Those kind of numbers. So is it safe to say that right now in each building there is infected individuals
That
without
is correct. Each
without
building, there's an inmate that's infected with
so
COVID.
without separating them and putting all the infected together, you're saying each building is pretty
They're
certain
all,
that
as
yeah.
right now, they're all mixed.
Wow. Wow. Wow.
Lana, we apologize for just throwing these
What
questions to
so
you.
what happened was you just cut everything down. They just shut everything because one, we're short staffed.
Okay, that's
So
another thing
everybody's
I
just
wanted to
locked
talk
down.
about. Mel was going to ask you a question. Go ahead, Mel.
Yeah, and it kind of ties right into that. But my question, and a lot of viewers right now is, where was the union? Where was the UPW? Where the
You
union
know,
did the
you
union
know,
step in and
I text the union. I text one of the representative for UPW on the 15th, and to this day I haven't received nothing. No text back, no response back, no nothing.
I mean, that's just you, but I mean, there's a whole bunch of other people, and again, it goes kind of right into the staffing. I'll let Charlie
Right.
ask the question about the staffing, but you would think that the UPW, I've not heard a thing from the UPW anywhere. We heard from the nurses union, we heard from the teachers union. We
That's
have
my
heard
question.
nothing from the UPW regarding OCCC. As far as the news is concerned, obviously, I don't have a direct link to the union or to the OCCC management, but there has been no formal statement. I haven't heard it from the UPW. And
Well, like I
to
said,
me,
I
they
text.
should have they were the ones that should have stood up. I mean, it's obvious that the policies and procedures of DPS is absent. They have none and they have failed, but that's you would think the UPW would have stepped up and try to correct this and get it back on track. But I have not
You
heard
know,
a thing.
first. Yeah, like I said, I text them on the 15th, UPW representative, and I had no response as of yet.
Thanks.
Let me ask you something, this Lana, regarding the staffing. Okay, I ran a post because and a source, and from one of the corrections said to look at something very closely, and that is, I cannot fathom. See, and I want to preface this in a way so you understand what I'm saying, so not to blindside you or anything. But it's hard for me to fathom the thought other than a fireman who works 24 hours, but they have a facility to sleep because they have to be on call during that 24-hour shift. My understanding is some of the guards, because of the shortages, right? Instead of making schedule changes, and I don't know if because if it cannot be accommodated or not, are requiring some guards to work 24-hour shifts. But as guards working 24-hour shifts in a prison, folks don't have time to do like a nap out to rejuvenate, because I mean, how do you stay on alert for 24 hours straight?
Yeah, it's impossible. So
But you
you
folks,
get,
they make you folks work that kind of shifts?
well, right now they are because of 40, 40 staff or so are out on, that's infected and out on COVID quarantine. So right now, yeah, especially right now, it's what's been going on. And from what I've been hearing, even staff that are positive are working because they don't have any leave on their books. They have no
Wait,
vacation, no
wait,
sick
wait,
leave.
wait. You just said something that caught my ear. So you're saying that staff who have tested positive are asked to come back to work. Is that what you're saying?
Yes, yes,
I
because they're
was
so
actually gonna
desperate.
I was gonna actually ask you if guards that are on quarantine, like yourself, um, or second level 2 contacts that may not have tested positive, but were in contact with guards or inmates that have tested positive, were being asked. I did see someone post on Facebook that that a husband was at home like yourself positive, that was asked to return to work. And I honestly cannot fathom that. I just cannot. Uh, and that is quite troubling. That is quite troubling, and it's bad enough. And 48 staff positive. Yeah, how you make the? You guys are probably already short staffed when everybody's working because of vacations and sick leave and all of that. Now you take 48 out. How do you get guards where they're supposed to be? And that's
Honestly,
where Charlie.
at this point, they're getting burnt out. Um, they are don't want to go to work. I mean, because it's such a high risk of catching a COVID, and they're afraid to take it home to their own family. I mean, we have 5 staff guards. That's 3 of them on ventilators, one hospitalized, one with blood transfusion. I mean, so that's what we're looking at. Some serious life-threatening, you know,
No,
situation right here that everybody's going
It's
through. And so, for me to look back at this and stay home because this is the safest, and I'm doing my quarantine, I'm following my protocol. It's really sad that this is happening, and
Okay.
When do you end your quarantine?
Shoot, I don't know. I found out I was positive on the 19th, so I took my test on the 16th. So I'm thinking like by the 29th.
Are you going to take a secondary test just to make sure?
Yes, I am. Just to make sure I'm on the all clear. I mean, I have a little boy I haven't seen in 2 weeks since the 7th. I miss him. You know, I miss hugging him, being around him, and it's hard. And he calls me every day. You know, it calls me every day, asking how I'm feeling. He's worried. You know, and I'm not the only one. You know, there's the other my brothers and sisters, same thing. You know,
Yep.
they're they're isolating themselves, so it puts pressure on the family, and you just can't. You know, I like I said, I didn't think anything was wrong up until the 7th, and that's when everything came down.
So
Well,
let you know, and let me ask you first. If we run a little over, is that okay? I want to
Yeah,
get your
that's fine.
permission first. Okay. Because I know there's still some questions in the back of my mind. It's I'm trying to wrap my head around this fact that the plans, PPEs, but more so, we have this outbreak. It's like the prison itself is like a mini city, so it's like a small cutaway, like the entire Honolulu, what they're facing with. So I'm trying to understand: is there anybody, whether it be a captain, lieutenant, whoever, sitting down with administration and said, hey, we got to generate a plan because, I mean, it almost seems as if, and I don't want to say this and I don't mean to demean any, the hard work that the guards are doing now, but it almost seems as if they threw in the towel and just said, you know what, just let it happen and we'll deal with it. I mean, am I
That was
off?
the kind of attitude I got from one of the captains. I'm not going to mention who the captain is, but that was one of them that mentioned like, you know, um, I've been in the military. We've been exposed to all this. Um, just not taking it seriously. And I feel that the whole department has failed and was thinking the same thing. That this is not a real situation where you can end up being hospitalized and on a ventilator. It's scary when you see your own brothers and sisters on ventilators. That's when the real stuff starts happening. That's when you start figuring it out. And these guys, the two that's on ventilators, they're young. They're in their 30s. They have young children. They're a young family. I hope and pray that they come through.
well, they got a bunch of prayer warriors on here tonight that's sending a lot of prayers. I know we have someone posted 5 ACOs fighting for their lives right now, and that's
They are.
that just makes me sick. It really does. The So there was no real mandate to take tests. There was no mandate.
There is no real mandate. I
Yeah,
know a few officers that refuse to take the test because they just can't take the time off.
bingo. That was you answered my question before I asked them. I said, are there any guards because they don't have they don't have paid leave, that are just not going to take the test and go to work and take their chances because they can't afford to stay home, knowing that whether they're positive or not, they got to quarantine. You take the test, you're home until the results come back, and God forbid, you come positive. So I know you don't know this, but I would be interested to find out what percentage of inmates have not taken the test. I cannot imagine the state allowing any inmate to work at that facility without taking a test. I mean that's I'm just flabbergasted that you could continue to work in a place with a cluster like that, an infection that's raging through that facility, and the state would allow you to come to work without taking a test. That's insane.
Yeah,
And you're saying some guards that just didn't take the test.
that's correct.
Wow. This I don't, there's a ton of people watching this. I know there's all kinds of people watching this, but you know Charlie, I knew it was bad. I knew it was bad. I mean, I think we heard a lot of.
I
I
didn't know
mean,
it was bad. I didn't know it was this bad.
Well, I mean,
yeah.
Bad.
it's different when you're hearing it from someone that's sitting at home right now, separated from her 11-year-old son, and riding out a quarantine, hoping that she doesn't get sick. And her brothers and sisters, many of them are who's on this show tonight, um, suffering the same thing. And yet, if you read the article yesterday, you know what the headline was yesterday on the Star Advertiser? I think it was, I forget which source. It says, oh, numbers at OCCC decline. You know, 5 guards fighting for their lives right now. I don't know how many are sick, maybe mildly sick, how many are in quarantine,
I
how
can
many
just
are
tell you from my experience from having this COVID, it's it's been challenging because the first 3 days I had a massive headache and I thought it was because of the 65 inmates I was exposed to, so I was a little stressed from that, and then followed from the migraine headache that felt like I had an aneurysm. 2 days later, after that, I had it followed by 2 days of sore throat that was like burning. After that, I lost my taste, my smell, and every morning I wake up now, I have phlegm, so I have to cough that up. But I've been doing some drinking a lot of hot tea, a lot of liquid. I think I lost about 5 pounds from this, but yeah, it's the symptoms are painful. Just to go through the symptoms alone is painful, and going through this alone is even worse.
I do want to say something to our viewers and to who's ever watching out there. This woman is a brave woman, and I saw a comment. I just want to let everybody know our show is a recorded documentation of her statement. So if the administration decides they want to retaliate against her, you have my permission to use our show as document. Okay? I don't want you to go without with no proof. You're on this show tonight of your own choosing because we talked about this. But I want you
Mm-hmm.
to know you can use whatever you want to use if anybody starts retaliating against you, okay? I just want you to
Okay, I
know.
also want to express like how OCCC is set up, and the reason why we have so many cases coming through OCCC and it's such a high number of COVID. Um, I want to express that OCCC is a pretrial felon jail. So with that, we get the homeless, we have the mental health, we have people coming down off of drugs, and then we have the COVID patients. So, inmates. So I mean, it's so many combination. It's so as far as like us having the proper, protection as far as wearing proper PPEs. I feel that OCCC is they need it the most. You know,
Yeah.
um, I hear Nolan talk about on was that August 14th. He talked to the Supreme Court about how Annex 1 was set up with Judge Genoza. And it upsetted me because he really lied to the Supreme Court, saying that the negatives are all on one side and the positive were on the other side of the dorm, which was untrue. And you heard it from me. It's all mixed together. To this day, positive and negatives in clusters of 54 and 58 are all mixed. And I'm only house.
Wow. Wow.
you know, um, I'm gonna read a couple of comments because I won't mention their names. I mean, it's public; everybody can see it. My husband was mandated to work before his test results were given. He had to call and call and call before receiving his negative results. Thank God, his results were negative. But again, mandated to work before you got your test results should be a criminal offense. And then Marie, my husband is one of the 3 ACUs in ICU and on a ventilator. Marie, whoo, prayers,
That
girl.
touches me because one of them is the one I train, and he's a good ACO. So that one hit me really hard.
Yeah, I'm an emotional guy, and I see this, and I hear your story, and I just get so angry because this stuff could have all been avoided. It could have all been avoided, and what really, anyway, it's just I'll save some of this for my closing comments, but you know, um, Clarence Nishihara had serious questions when the
He's on
spin that went
tonight,
up.
Mel. He's on
Oh,
tonight
he's
right
on.
now.
Oh, he
Yeah,
is.
the head of public safety for the state senate is watching you tonight. He's
Well,
listening to all of this.
I
We have
watch.
Representative D. Morikawa on tonight. So
Yeah,
your voice is not silenced. But
I mean,
like
I'm willing to talk to anybody that's willing to listen to help us because we're in need of help. Our mission
you know,
statement is to uphold justice and public safety by providing correctional and law enforcement services to Hawaii's communities with professionalism, integrity, and fairness. That's what we're all about. But our upper chain of command, I don't know what's happening with them.
well, I can tell you, I watched Senator Nishihara during the reappointment hearings for Nolan Espinda. He brought up some major concerns. The biggest supporter for Nolan was the UPW, was Dayton Nakanialua. He was there saying, this brother is a good brother, and he may be a good brother, but he's a horrible leader, and he's getting people sick. That's what's really irritating me because people are getting sick. Um, when you talk about the, and I heard him say this in front of the legislature. What you just said, that they're separated. No, they lied. They lied, and I hope our legislature, whoever's on tonight, takes this to the next level, starts an inquiry, do a formal legislative inquiry to find out why this happened. Um, the state needs to do it because the attorneys will. Attorneys will. I'm hoping. I'm going to send a copy of this video, this YouTube video. By the way, this YouTube video will be available tonight after the live broadcast on my YouTube channel. And no, I don't get paid for that either. Whoever, to that person that thinks we all get paid. But I'm going to send that YouTube to our congressional delegation as well, because this stuff has to stop. And
It does. I'm proud of where I work. I've been there for 20 plus years. As a sergeant, I got pinned by Captain Liai. And you know what he whispered to me? He said, always do the right thing. So with that, I hold to my heart all these years, 9 years, and I want to do the right thing. Not only for me, not only for my brothers and sisters, but for the whole community. It affects everybody, even the inmates. Our lives are at stake. Everyone, the whole island.
now let me ask you one last thing, then I'm gonna turn it over to Mel. With the infection really out of control, what measures do you have do you know when officers go back to work? Are there any kind of throughout a shift? Does the medical staff check in on any of the workers or any of the inmates, or everybody just has to wait for a symptom to happen and then they'll respond, if any?
That's what it seems like right now.
They just wait. They just wait for something to
Yes.
happen.
Yes.
Oh boy. Boy.
Lana, um, thank you. Thank you for stepping up. I know this is tough. We come across a lot of people. Every day of our lives, Charlie and I, we get messages, we get emails, we get phone calls, we get text messages from people that are going through some rough times at wherever they're working, and it could be in different departments in the counties or the state. And our advice is the same thing. You gotta say something, and not on our show. I mean, you gotta report it to somebody. and everybody's afraid because everyone's afraid of retaliation, retribution, and you're
I mean,
protected.
when the upper chain of command, like the captains and lieutenants don't want to go to the housing units and do their security checks, that already tells you, okay, they're afraid. They're afraid of this COVID. So are we. We're afraid of the COVID as well.
Well, you
You know,
you're living proof. You got it.
yeah,
You
exactly. And
you
I
got it.
tried hard to prevent myself from getting it, but unfortunately, I tested positive.
I think every expert has told us that closed quarters, like correctional facilities, like jails, like gyms, like schools, like anything that's enclosed is very dangerous. And I mean, my God, 243 inmates, 48 staff. That's bad for one facility. And again,
Well, that night when the news came out with 70 inmates being infected, out of the 70, 65 was from Annex 1 alone. So,
well, it's a definite hotspot. It's
right.
and this virus, of all people, how contagious this thing is, how easy it is to pass. And again,
So
it's just a
let me
sad
ask
thing.
you something. So when that when that initial what you just said of that 70 65 was from Annex 1 alone, no one from administration even remotely hinted a contact trace start at all. Nobody came over there and asking, okay, who this person, who, nothing like that. They just said, okay, just stay behind your bars and we're gonna lock you in. We're on lockdown. That's all they did.
I was just instructed that the inmates stay in the dorms. Dorm 1, dorm 2, just stay in there.
Wow. Wow. So
So they're in clusters. So my question was, how are they supposed to be isolating? How are they supposed to have social distancing? How are they going to get well? Because now I'm the supervisor, I'm responsible for their health as well
yeah.
and their well-being, and so that's what alarmed me. I said, this is just too much, and that's the reason why I think I had a headache, and I was thinking that it was just from the stress from all this, but I actually was positive for COVID.
Well, I'm sure the stress never helped. The stress just
Yeah.
intensifies all of them symptoms, and it's just a sad thing. I just have one more question as far as for the inmate. I mean, for the guards, when they go to work, are they temperature checked or anything like that? Is anything being done to help stop the spread of this after all of these cases have popped up?
Initially, when you walk through main gate, main entrance, there's a temperature table there, and there's an ACO taking every temperature from the ACO. Yes, and there's a form that we fill out. It's a generic form that it's the same form every day.
That you never come in contact with anybody positive.
But now, right? But now it's like, okay, yeah, I came in contact now. Now I came. That was one of the question everybody has to put down now, is that yes, I came in contact. They have to
But
check
testing
that off now.
testing is still not mandatory.
Testing is still not mandatory. No.
So I guess the proverbial stupid question I'm gonna ask, and you can laugh at me because it's gonna be on stupid question, is you get all these infected people. I guess no use give a mask, right? Or did the state at least make an attempt to give them one mask?
They gave him a mask, like I said, the cloth mask after the fact.
No, but these are the inmates.
Right.
Okay.
I gave them after the fact. I let my lieutenant know that I had 65 positive, and I guess he let the chain of command. The chief ended up sending an admin ACO to bring a bag of cloth masks, one to each inmate. But like you said, it doesn't help the spread. It's not for COVID, and
In the past, they've had directors of different departments, like when they had the contamination on Maui, the water. because of the sewage treatment. The director, no, I'm sorry, it was in Oahu, and they have this plant over in Hawaii Kai side, and I guess this is way before, probably before you was born. But anyway, he wanted to prove a point that the water was so clean before it was discharged in the ocean. He jumped in and swam just to prove to everybody, because the news was there, that hey, this water is clean, because he was getting hopped on violation, Clean Water Act, and all that stuff. I think if Mr. Espinder and all the upper management of the prison system was confident, I would think that they would probably go hand in hand and walk through Annex 1. But you don't see that happening anytime soon, do you?
Nope. They won't even walk through that gate. Nope. In fact, the lieutenant's like, can you bring the logbook over here to the gate?
But
because
He
they
went
don't
there
want to walk
today.
in.
He went there
Yeah.
today. I heard he was there this morning early bringing pizza.
And
Oh,
Manapua,
yeah, that's Nolan. I heard
Manapua.
he bought like 7 large boxes of pizza and 3 boxes of manapua for all the
Yeah.
staff.
Yeah.
But he
But
didn't
he-
want to go through the gate. He just went to the main entrance, dropped it right there, right in front. But he didn't want to walk through the facility. Yeah, it's true.
What he should have been dropping off was some N95s. That's what he should have been
Yeah.
dropping off. You know, pizza ain't
That's
gonna
what I
save your
said
life.
instead
No.
of pizza. Mhm.
Wow. Anyway,
Oh.
jeez. Girl, proud
girl.
of you, man. We support you.
Yep.
Any other comments we have? We broke the record tonight, by the way, on viewers.
Yeah.
We did. And any comments to the people watching? You got a lot of brothers and sisters on here. You got a lot of friends and family on here. You got a lot of people that met you for the first time tonight here tonight. What is your closing comments to them?
Thank you for watching. You know, this has been a challenging time for me and everybody at OCCC. I'm happy for the support and love and prayers that you all have been given to me, and calling and texting my family from Big Island. You know, I really appreciate it. This is what I needed, support. I was really scared to get into this. I was contemplating. I was, nervous.
Charles, I know it's tough, girl.
And I want to tell the truth. I want the community to know about what's happening.
Well, first of all, Lana, I'd like to say that you're one brave person, and I think you have systematically gone down your own recollection. And see, a lot of times we talk to individuals, and sometimes they'll, through excitement, they'll kind of jump ahead. But you allowed us to ask you the questions, and I know some were hard, but you systematically laid out what's happening behind those prison walls. Because for us as viewers, we can only see the end result, and that is all kind of crap is happening, and we can't understand why it's happening. But based on what you said tonight, now I know 1 + 1 is 2. I thought all this time I was saying, hey, 1 + 1 is 8 over there. Something was happening. Now I see where the disconnect is. So I want to tell you, thank you very, very much. I want to reiterate again, this show, I understand you have an attorney. He can use this show anytime for any kind of proof of what you said. And if anybody challenges you or threatens you, because basically you're a whistleblower, you're protected. But if you need to use this show as a backup proof, you have our permission to use it, okay? Because I don't want nothing happening to you. To the viewers out there, you got firsthand to see somebody coming forth and telling the truth. And sometimes someone has to step up and do that. And I hope to the brothers and sisters out there that work behind the walls at all of our prison system, just know that you're not alone. We're in a pandemic, but you guys don't need added crap added on top of that, okay? So just know that, there's people like Lana, there's people like me and Mel, that we're gonna search out the truth. And We hope and pray that it gives you good results, because all we want to do is inform and educate. That's where we're coming from. Mahalo. Mel?
Well, Lana, thank you again for your service, 21
Okay,
years.
thank you.
Hey, no go no place yet. We're not out yet. Hang on, you gotta hear me now. 21 years of service, 9 years as a sergeant. You know, I mean, that's, you can retire already if you wanted to, but you love your job. You know, you love doing what you do. You guys provide a valuable service for all of us in the community, and for those inside that deserve to be treated well as well. The inmates deserve to be treated as humans, and you guys are tasked with that, and you guys don't need this rubbish over you guys' head. What we heard tonight was a total dysfunction, just a horrific representation of leadership at DPS and at the facility. And we've heard the rumors, and we've heard it tonight firsthand, and it's frustrating. And we will follow up with this. I can promise you, Lana, and to all the brothers and sisters out there watching, I don't care what triple C you're at, K triple C, M triple C, H. I don't care where you're at. Halava,
KFC.
KFC. I can promise you, Charlie and I will make sure that this information gets to the people that can make a difference. And that will happen first thing tomorrow morning. Actually, it'll happen tonight. We will
Mahalo.
send this out to everybody tonight.
Brother,
The hope.
I got something for you, Brother Mel.
What?
Remember, we were talking about maybe possibly getting some kind of investigative hearing or whatever.
Yeah.
Well, one member of the Public Safety Committee, along with Senator Nishiara, our good friend Glenn Wakai. Lawmakers have a lot of questions for Director Espinda tomorrow afternoon. So there is going to be a Q&A of him.
Well, that's, we didn't set it up that way, but hey, it works. And, it's going to be important because, again, I have watched enough of those Senate hearings, whether it was DOH, whether it was finance, whether it was Espinda. Just create answers to get through the answering question session. I've seen it. I've been a cop. I've been a legislator. I know the game, and I've seen them lie their way right through. And now, tonight, they have evidence in the way of your testimony that they're not getting bullshit no more. They're going to have to answer the question. And that was we was hoping to accomplish tonight. Thank you for that, Charlie. That's great. Lana, thank you so much. We love you, man. We pray for you and your son and your family and all of you out there, all of you employees, and again, all you Triple C employees, especially those that are sick, the 5 that are on fighting for their lives. Gosh, we pray for God's help on you guys and blessings. We need you guys back to work healthy and to be back with your families. So please know that you guys got a bunch of support. Viewers, thank you for an amazing showing tonight. We will be back tomorrow night at 7 o'clock. You guys all take care. God bless. You guys be safe. We love you folks. Lana, you stay safe. Good night.